Dr. Jason Saunders here with HBOT USA. We did a video, released it a couple days ago, about COVID-19 and hyperbaric. It was actually a specific response to a video that Dr. Kyle-Sidell did from New York, and he was voicing his concerns that the pathology behind coronavirus, this particular coronavirus, it may be different than what we initially thought, and therefore the treatment strategies may also need to adapt to the changing information that we're getting, primarily being that, instead of a more standard type pneumonia, we're looking at, some type of oxygen absorption issue. Maybe it's a hemoglobin issue, maybe it's an oxygen delivery issue, but it's clearly taking the form of something different than the standard pneumonia. Now, this information's literally changing every day, but what we want to do is we want to just offer information as we understand it so that people can kind of follow along as best as we can. The video I put out a few days ago has brought up a lot of questions and comments regarding just oxygen, period. Why do we need it? How do we get it? How do we get more of it? What happens when we don't get enough? And so what we want to do is we want to put together a series of videos answering all those questions. We're going to do them one at a time, and we're going to try to keep them pretty simple. And just to sort of hammer out the mechanisms of oxygen in our body and understanding a broader concept of why this is so critical and why patients are getting so sick. So the first question is, what is oxygen and why do we need it? And so basically, oxygen is an oxidizer for the most part. In order to take a fuel and burn that fuel, we need oxidation to occur, passing of electrons, if you look at it molecularly. And so as we're passing these electrons, you're taking a fuel and you're literally burning it. I think the easiest comparison is a car's engine. And we'll compare a car engine to our cells. So basically, a car requires some sort of fuel, we'll call it gas. It requires air or oxygen, a spark, and then an exhaust system to get rid of the waste products. So as long as you deliver gasoline, you mix it with oxygen, you create a spark, which creates an explosion. That's what gets the engine actually rolling. And then you have an exhaust pipe to make sure that you're getting rid of the carbon monoxide, but you're getting rid of the exhaust fumes. That system can continue to run, but a hang-up anywhere along those lines will create a problem in that system. And so in our cells, our fuel is either glucose or fatty acids, basically. So we're taking in sugar and fat. We have to oxidize that. So we need to mix that with oxygen. We make energy with that. Our energy is called ATP in our cells. And then when we exhale, we blow out carbon dioxide, which is our cellular waste product. So as long as we could breathe in, get oxygen and gas exchange to occur, which we'll cover in another video, we could basically use that oxygen to oxidize our fuel sources, and then we could exhale our waste products. Our engine can run efficiently. Literally, the only reason we breathe is so that we can deliver oxygen to our cells so that they can burn their fuel, and exhale waste products so that we can keep that engine rolling. That's literally the most simplest term to describe why and how we need it and how we get rid of the waste products. Coming up, we'll talk about other very specific oxygen-related questions. Thanks a lot.